Hi, my name is Kiran Bhagat and we're back talking about various things. We've introduced ourselves and in brief for those who've not tuned in last time, I'm a heart specialist who also has an interest in preventative cardiology and a background in what's called clinical pharmacology. That's the study of drugs and drug design, and we talked about the basis of cardiovascular disease, the basis of most diseases, which lie in what you do to yourself and the environment in which we live. How we eat and how sometimes we poison ourselves, and eventually you do the wrong things, your body will punish you. The subject of today is to talk about a very common topic, and that is the topic of a racing heart, which we call in medicine palpitations. Often presents to a heart clinic or a cardiology clinic where they say that, you know, suddenly my heart is skipping, or it's missing, or it feels like my heart is sinking, and occasionally my heart is sort of fluttering like a butterfly in the chest. We know this is palpitations, and it's not always a cardiac issue, and it's really important because the basis of these series really is to be your own doctor. You are your best doctor. You know your body more than anybody else, and it's always important to remember that if you go to a health facility and they don't find anything wrong with you, it does not mean that it's an imaginary symptom. It usually means they've done the wrong tests. So persist. If you're getting chest pain, if you're getting palpitations, if you're getting dizziness, but the doctor or the nurse or the hospital says there's nothing wrong with you, you've gone to the wrong place. Move on to try and establish exactly what's the cause of it, because the body doesn't lie. So listen to your body, question your body, and in terms of the palpitations story today, if you're somebody that does get a racing heart, for example, ask yourself, when did it start? What are the situations in which the palpitations or rapid heartbeat occur? Does it occur after a meal? Does it occur after, an energy drink or a soda? Does it occur after a particular type of food? Does it occur at night? Does it come with any difficulty to breathe? Does it come with chest pain? Is it momentary? Is it more than a few seconds? Does it last for minutes or hours? Can you feel it when you put your hand on your chest? And does it make you feel dizzy? What are the other things that occur when your heart is racing? This will actually tell you a lot more in terms of the relationship between what you're doing possibly and what's triggering that rapid heartbeat. Often the cause of a rapid heartbeat may be stress. You haven't slept very well. You're perhaps taking too many Cokes and energy drinks and Red Bulls, which really shouldn't be part of your daily routine anyway. Or you may be staying up late at night and not getting enough sleep, and the heart is actually just warning you that it's tired and it's racing. It may be that you've got a lot of stress in your life. Remember today, stress, like we've said in our previous series, is not that lion chasing you. Stress is the boss in the office. Stress is the tray that is always full. Stress is financial, marital, emotional, sexual, medical, bereavement, and so all of these things can drive the stress chemistry in your body up, producing a chemical called adrenaline. In North America, it's called norepinephrine, and this actually, or cortisol, which is a stress chemical, can actually make your heart pound just all of a sudden. So it may be the environment in which you are behaving or acting daily that is the cause of your palpitations. So think carefully about what the triggers are, how long they are. Are they coming with any difficulty to breathe? Do they just spontaneously stop as quickly as they start? Or do they gradually taper off, almost like a sort of a decrescendo? So these are things that you need to ask yourself, and you may actually come to the point where you understand that I mustn't eat this, or I mustn't drink this, or I need to get more sleep, or I need to manage my stress better, because you've worked out that that's the cause. And by doing that, if those palpitations or that rapid heartbeat begins to slow down, then Bob's your uncle, you have the answer. If, however, you look at yourself and you think, I've not done anything unusual, it's a normal day in my life, I haven't changed my diet, I'm not taking any unusual liquids or drinks, I'm not extraordinarily stressed. Everybody has stress. Where is it written? Life is not easy. And if all those things are normal and you're still getting palpitations, then perhaps you ought to go and see a doctor or a hospital to see what those palpitations are. So if, on the other hand, your palpitations are what we call just a single flutter, where almost like the heart skips a beat, it sort of thuds and then stops and then starts again. those are what we call ectopics, where the heart misses a beat. Those singular episodes can be historic, and you may just become more familiar with them as you get older or as they become more frequent. Often they occur in women who have menopause, where the hormones are changing and they start getting palpitations, particularly at night. And what we find is they have these ectopics, which basically in Latin means an extra beat. So all these things can count in terms of palpitations. If you're somebody who's young and you start getting palpitations, we as clinicians take it more seriously, because a young person rarely has stress, rarely has coexisting conditions. A young person who has a sudden rapid heartbeat is more likely to have an issue to do with their heart, what we call congenital, which means it's actually you're born with it and it's now developing as you're growing up. And we'll come to that in a minute. So in terms of going through that routine of asking yourself questions, doctoring yourself and looking at yourself as to the spatial, is it frequent, is it daily, is it weekly, is it monthly, is it occurring with lack of sleep, is it occurring with what you've eaten, will give you ideas. If none of these things have changed, go and see a doctor and have that list ready to say, this is when it occurs, this is how long it is, there's no relationship with food or drink, I'm sleeping well and I'm exercising, I haven't put on weight, I'm not eating too much, what is the cause? And the doctor will probably then listen to your heart and do what's called an electrocardiogram, an ECG in the UK and the colonies, if you like, in North America is called an EKG. And that is basically looking at the electrical rhythms of your heart to see how regular it is. Is the electrical pattern normal? Is it showing signs of abnormality, indicating the need for more tests? So that's a basic test to understand. The doctor will ask if you're taking any other medication. Some medications may cause your palpitations. You may be taking asthma medication that can actually cause your heart to race. You may be taking steroids for skin disease or autoimmune diseases. So some drugs may cause the palpitations. Remember always when you go to a doctor to volunteer some of the things that you take without a prescription. A lot of the things that people take that they don't volunteer to their doctor. You may be taking supplements. You may be taking Chinese remedies. You may be taking Ayurvedic medicine, which is Indian medicine. You may be taking homeopathic medicines. Be careful to volunteer this information, because often when you go to a homeopath, they don't label the drug, so you may not know what you're taking, and that may be actually causing your palpitations or dizziness or chest pain. And then further to that, if the doctor thinks that the ECG warrants further investigation, you may actually order what's called an echocardiogram. We've talked about this before. An echocardiogram is basically where we throw echo waves into the heart, or a Doppler, where we look at the structure, the function, the blood flow, the anatomy and architecture of the heart to see if there are abnormalities that are causing the palpitations. So these are various tests that the doctor can do. If the palpitations are not very frequent, they may even actually attach a little recorder on you to record the rhythm of your heart over 28, 48, or even 72 hours to try and pick up these palpitations, because once we know what type of abnormal rhythm you have, it's easier to treat it, whether it's with medicine, lifestyle, or the avoidance of certain foods. If it's a young person and we have an issue where the heart is suddenly racing, they faint, they get chest pain, they get short of breath, we take it more seriously, and that may be a congenital condition or an inherited condition where you have what's called a supraventricular tachycardia. Long word, but basically what it means is electrical wires are fashioned in utero, in the mother's womb, in an abnormal fashion, and as a result there's an electrical discharge which suddenly makes the heart race and suddenly stops, and it can go so fast. Ordinarily the heart goes between 60 and 80 beats per minute, may even go up to 200 beats per minute, and causes such a rapid heartbeat there's not enough blood going to the brain, and the young man or young girl faints. And that is actually something that we take very seriously, and we proceed to do more investigations, and the treatment of which is to try and remove that electrical abnormal circuits. In terms of the elderly or the middle-aged, we sometimes give drugs that slow the heart rate down. Natural remedies include omega-3 fish oils, which calm the heart down. Magnesium, particularly magnesium threonate, magnesium citrate, magnesium succinate, magnesium glycinate. These are, if you like, chill factors. Magnesium chills everything in the body. If you've got abdominal cramps, magnesium will help. If you've got muscular cramps, magnesium will help. We use magnesium to drop blood pressure in pregnancy because it actually chills the heart down. So magnesium may be prescribed. Natural other remedies are, particularly if you're stressed, are some of the teas, the green teas, the chamomile, the ginger, the peppermint, the spearmint can actually slow the heart rate down. So there are natural things you can do. Deep breathing exercises, understanding breath work, taking slow deep breaths actually triggers what's called the vagus system, which is a system that slows the heart rate down. If those things don't work, then obviously there are drugs we can use to slow the heart rate down. We use them with caution because all drugs come with benefits and disbenefits. So discuss all these things with your clinician when you do have palpitations, because often a cause can be found, it can be treated and can be managed in the long term.